Hello, I'm Margot Carlin, and together with my colleague Elizabeth Amuli, we would like to introduce you to Business for Health Solutions. Our mission is to increase healthcare access in Africa. We seek to develop a sustainable healthcare industry in which local healthcare enterprises are able to deliver quality, affordable, and accessible health products and services to their communities. We work to build the capacity of healthcare enterprises by facilitating remote technical assistance projects delivered by teams of highly skilled corporate volunteers. Our mission is so important. Fewer than 50% of African families have access to modern healthcare. Healthcare needs for families are largely unmet in the public health system due to system-wide constraints and underfunding against a backdrop of rising healthcare demands. Compounding the problem, poor and rural populations often have no access to public healthcare facilities. 37% of health spending is out of pocket, and almost 40% of patients delay or forego healthcare due to cost. The private sector is essential not only in healthcare provision, but also plays a critical role in retail, financing, manufacturing, and distribution. Private sector growth is essential to fill the gaps in healthcare access. Private sector enterprises, however, are capacity constrained by skills and resources, and capacity building opportunities are very limited. Most initiatives focus on the public sector and selected NGOs, and major donor investments focus on specific diseases and public channels. Capacity constraints in the private sector must be addressed. The BHS solution is to provide remote technical assistance to local healthcare enterprises. There are two key differentiators to our model. Firstly, we're able to solve the deep technical challenges faced by our clients. We are demand-driven, working with clients to identify their challenges and meet their business needs. The technical assistance is delivered by international private sector experts through skills-based volunteering opportunities that BHS provides to corporate partners. Secondly, our program is highly accessible. Projects are easily managed via remote conferencing technology and are very low cost. Another key aspect of our model is the role that BHS plays in managing projects and measuring outcomes. BHS supports both clients and volunteer teams every step of the way to ensure project success. We connect clients to teams of 3 to 4 expert volunteers with relevant skills and industry experience. We work with the teams to scope the project, ensuring goals and timelines are clear. We play a strong role in project facilitation, staying closely connected to the teams over the 4 to 6 month project period. And after results complete, BHS continues to monitor implementation and assess results for client and the community. I'll now hand over to Elizabeth to tell you more about our clients and our impact.
Thank you, Margot. Why are our BHS clients important? BHS clients provide valuable contributions to the population health as they play an important role in the healthcare value chain. Through their companies, they provide products and services to large segments of the population. Our clients vary in size, capacity, in their processes, and the complexities of their systems. We initiate our projects once the client agrees to commit to working with BHS and to implementing the recommendation from our expert volunteers. Here are some examples of the diversity in our clients and the impact of the BHS projects to their businesses. One is a local pharmaceutical manufacturer, a distributor, and another is a healthcare provider at hospital level. The BHS project with the local manufacturer led to the development of new quality risk management protocols, which improved the quality of essential medicines produced. Following the project, the client reported 0 recalls and 0 market complaints. The distributor of essential medicines and supplies managed to transform purchasing and order fulfillment procedures, resulting in more medicine being delivered by an increase of 17% and reaching the facilities faster by 50%. The healthcare provider project involved a need for advice and guidance on launching a new service and opening a new maternal and newborn facility, which would oversee up to 1,200 high-risk deliveries in a year. So our primary drivers to estimate health impacts from BHS activities include the type of products and services that have been improved by BHS technical assistance projects, which are the outputs. the level of improvement measured in quantity and quality. The outcome we see is increased number of individuals accessing the products and services from BHS healthcare enterprises. Impact is determined when we see reduced mortality in key demographics. We've now seen the breadth of our work with diverse clients across the healthcare value chain. Let us have a look at the value created for our partners and our stakeholders. For our clients, their employees and leadership gain skills and expertise. They receive expert advice to solve key business challenges, which in turn help them to grow their businesses. Feedback from our clients is very positive, reporting 92% satisfaction. BHS clients agree that the project addressed an important healthcare need and they would recommend BHS to others. For our volunteers, we see a reported development in skills and competencies, most notably creative problem-solving skills, cultural competency, change management, and insights to African markets. The volunteer experience also generates a lot of personal satisfaction. 100% of our volunteers would recommend BHS projects to their colleagues. Nelson, the procurement manager of a Tanzanian distributor, highlights how expert advice has helped when he says, the project had brought positive impacts to our company. Processes that seem difficult to practice are now being followed, making things work better. Eva, a volunteer in the Netherlands, commented that it was particularly inspiring to support African women in a professional leadership role. Corporate partnerships are key to BHS success. We partner with global healthcare companies who are looking for skills-based volunteering opportunities and ways to engage their employees in access to health initiatives. BHS offers a fully managed virtual volunteering program that builds leadership and problem-solving skills in a multicultural, resource-constrained setting, and that is measured for impact. A favorable outcome of the current pandemic has been that many corporates are looking to increase virtual volunteering, either to replace existing in-person programs or as a way to help remote working staff feel connected. One corporate volunteer manager we spoke to recently reported receiving inquiries for more than 5,000 associates, a 200% increase over the previous year. So the ultimate goal of each one of our technical assistance projects is that the communities served by our clients will have increased access to quality, affordable, and accessible healthcare products and services. We estimate that on average, each BHS project positively impacts the lives of 100,000 individuals. I will now pass back to Margot to explain our business model.
Thank you, Elizabeth. Our business model seeks to align our revenue generation with our value creation. A major source of income will be financial contributions from our corporate partners. After trialing our model with a pilot project or two, we ask corporate partners to contribute $50,000 to $150,000 per year, depending on project volume. We will steadily grow this income stream as we grow our consortium of partners. We are actively working on growing our donor base and anticipate working with a small number of donors to fund strategic initiatives and expansion into new markets. Our target is for new donor contributions to match corporate contributions. We have identified an important potential income stream from impact investors and larger age initiatives able to pay a fee for service for technical assistance for investee clients. We target $20,000 per relevant project, covering fully loaded project costs. Our services are currently free of charge to our clients. In future, we're considering charging a small participation fee. Looking at our successes to date, BHS was founded in 2018 and conducted a pilot in Tanzania in 2019. We've built a small team based mainly in East Africa. We have secured a 3-year, $1.5 million grant from Fondation Botnar, a Swiss foundation which funded our early feasibility study and pilot. We've completed or launched 16 projects to date, supporting 12 clients across the healthcare value chain, leveraging the skills and expertise of 40 volunteer experts. And most importantly, we've increased healthcare access for 1.5 million Tanzanians. We are poised for growth with a pipeline of more than 50 potential clients, including repeat clients, referrals, and network recommendations in other countries. And we continue to build partnerships with global corporates, donors, and in-country stakeholders. We are fortunate to work with an amazing group of organisations who support and fund our work. Our volunteers represent a broad range of international healthcare companies, including the pharmaceutical sector, health insurance, and US health systems. Our startup and scale is supported by 3 key organisations: Partners in Food Solutions, GDI, and the Miller Centre for Social Entrepreneurship. BHS is modelled after Partners in Food Solutions, an acclaimed non-profit with a 12-year track record providing technical support and training to Africa food processors. Partners in Food Solutions works in 11 African countries, supporting hundreds of local enterprises through their pool of over 1,000 volunteer experts. Global Development Incubator is a global non-profit that launches social impact startups. BHS was conceived as an initiative of the Global Development Incubator in collaboration with Partners in Food Solutions and Fondation Botner. Looking forward, we have ambitious growth plans. By 2025, we aim to have provided technical assistance to 100 clients, be operational in 5 countries in East and West Africa, have reached financial sustainability with 70% of revenue generated from corporate partnerships, impact investors, and clients, and have increased healthcare access for 15 million people. Our pathway to scale and impact in 2021 sees us expand our country footprint, continuing to scale in Tanzania, expanding to Ghana, and pursuing opportunistic projects in Kenya and Rwanda. We will add 6 new team members, 5 of which are planned to be in Africa. And we will start to build and invest in a digital platform, a project and volunteer marketplace which is essential for us to scale. Our 2021 budget is $900,000, of which $600,000 is already committed. We invite you to invest with us. We're looking to raise $750,000 of grant funding in 2021 and 22 to expand our operations into Ghana and 1 other market, build a digital platform for volunteer and project management, hire additional staff in Africa to run programs, M&E, and IT. This investment will enable us to provide remote technical assistance to an additional 20 healthcare enterprises and increase healthcare access for over 2 million people. The BHS team is experienced in global health, health systems, clinical services, private sector engagement, and entrepreneurship. On behalf of the team, I'd like to thank you and hope that you will join us, increasing healthcare access in Africa.